Hello, I am Rodrigo García Salinas from Argentina, and thank you very much for letting me present our research, axial involvement in psoriatic arthritis, effect on peripheral arthritis, and differential features with axial spondyloarthritis in South America. Reported data of axial involvement in psoriatic arthritis are variable. This variability is mainly linked to different ways to define this feature. Gladman established that the prevalence of axial involvement was close to 50%, and that is associated with HLA-B27. Psoriatic spondylitis, unlike in ankylosis spondylitis, is characterized by not having a greater preponderance of male sex, greater skin involvement, and less severe course. Regarding the objective and method of this research, that was an observationally cross-sectional single-center study. The principal objective was to estimate the frequency of axial involvement in patients with a recent diagnosis of PsA in a rapid diagnostic sequence called Ruta check, and to carry out a comprehensive characterization, such clinical, laboratory, and imaging. The secondary endpoint was effect of axial involvement in other manifestations, and finally to compare all the features with a group of patients with axial spondyloarthritis diagnosis in the same circuit and in the same time too. Patients included were older than 18 years old and was admitted according to the following criteria: musculoskeletal symptoms such as arthralgia, arthritis, dactylitis, and or enthesitis associated with a PCO or family history. Once a diagnosis of PsA was made, the presence of axial involvement was investigated. Axial involvement was defined as a chronic low back pain associated with at least one of the following criteria: PASDAI greater than 4, positive sacroiliacal clinical test, and or inflammatory low back pain. If the patient met these criteria, a second Ruta check was performed for the complete study of axial involvement, for example, HLA-B27, X-ray, MRI, and BuzzFeed. A total of 139 patients, consecutive patients with musculoskeletal symptoms plus PCO or family history were admitted. Of these, 73 patients were diagnosed to psoriatic arthritis. Here is the characteristic of patients with psoriatic arthritis, clinical, laboratory, and images features. And finally, 24 patients out of 73 patients were diagnosed to with psoriatic arthritis, had a clinical axial involvement, 33% of the patients. Here we have the main characteristics of the axial involvement of that patient. For example, almost all had an inflammatory low back pain. We have a low frequency of HLA-B27. We have a near to 40% of MRI positive circulated by MRI. In this cell show the clinical difference in peripheral manifestation between the patient with or without axial involvement. It should be noted that the patient with axial PsA have a higher frequency of SPA features, such as uveitis, for example, and a high number of enthesitis, and more functional compromise due to HIQ. In the multivariable analysis, only 2 characteristics had an independent association. Is in the blue box. In the comparison with our core or spondyloarthritis, with the assessment in the same sequence in the same period of time, you can observe the several differences, and we highlighted that the patient with axial PsA are older, and high proportion of smoking, and, for example, more time of morning stiffness. As a strength of and weaknesses of this study, we have an assessment of axial involvement in PCI in Latin America that is very important in a comprehensive way, and the impact of this in peripheral arthritis. And also compares the difference between axial PCA and axial spondyloarthritis. For weaknesses, we were unable to establish the temporal relationship between low back pain and the other sign and symptom of PCA. And in conclusion, the frequency of axial involvement in our PCA core was 33%, and this frequency is similar to previously described. The characteristics of axial involvement were inflammatory low back pain with high disease activity for FM such as greater than 4, low frequency of HLA-B27, and 40% of acute involvement in MRI. Patients with axial symptoms had a higher burden of peripheral diseases. There are differences in the age of onset, clinical, laboratory, and imaging between the patient with axial PCA and axial spondyloarthritis. Thank you very much, and don't forget visit www.jrim.org.